Alright, so now today I have to perform the process of catheterization. Alright, so what I'll do is I'll gather all my supplies. So in my supplies I have gathered all of them. Second, I'll hand hygiene. Then I'll go inside and then meet with the client, introduce myself. Hello, Miss Helen. My name is Abbas. I'm your nurse. I will be doing the process of catheterization on you. Are you okay with that? And how it works is like I have a catheter, which is a tube which I'll be inserting in your urethra, and so that we can pull out some urine from here. So, and I'll be touching different areas of your body. Would you be okay with that? All right, thank you. After that, do you have your name tag so I can check your ID? Do you have your date of birth also? So 2 IDs I will check. After that, I'll provide the privacy. So I have lowered the curtain or closed the curtain. After this, I'll do the assessment on client, perform the assessment. So for performing the assessment, see I have touched that, so assume that I have not touched the body yet. I was just making it straight, but I have not touched the body yet. So perform the assessment. Miss Helen, you have allergies? Do you have any allergies? No? Any pain, discomfort? Can I check your bladder? So I'm checking the bladder now. Miss Helen, your blood has descended, so the process of catheterization will be done on it. You okay with that? All right. After this, I'll prepare the environment. When I'm preparing the environment, I have my stuff. I'll put them in a neat and clean place. So this is my normal saline, which I'll be using as a cleansing solution. This is my catheter. Actually, this is a Foley catheter, but I'll be using it as an in and out catheter because that's what we are doing today. So, and this is the catheterization kit tray. So now it has the tray inside and other material inside. All right, so I'll put it here. Okay. After this, I'll raise the bed to my comfort level, to my waist, and lower the bed rails. All right. After this, I'll prepare the client. To prepare the client, I'll do the hand hygiene again, and I'll position the client in dorsal recumbent position. Okay, Miss Helen, I have to set yourself in dorsal recumbent position with your hips externally rotated. So I set up that. After this, I'll prepare the kit. I would prepare the material, or what should I say, the kit for. I'll prepare all the material for catheterization. So equipment, you can say, I'll prepare the equipment for catheterization. So for that, what I'll do is I have the tray here, so I'll take out the tray. It's packed with another packing. Okay, this packing is going in the garbage, so this packing is going in the garbage. We have another packing here. I put in the neat and clean area. This is going in garbage again. All right, how would I open it? I open from the 1-inch margin. Make sure that you open from 1-inch margin. Okay, yeah, make sure that you don't touch the inside of this tray, inside of this field, because all still hold it from here, 1-inch margin. Hold it from here, 1-inch margin again. Make sure that you don't touch inside. And now you have the forceps. Put the forceps here so that it does not move. The field does not move. The paper does not move. Mat does not move. And open the 4th corner. Holding it from the 1-inch margin again. Now what I see inside is the container which has swabs. I'll be using the solution, cleansing solution in it. Then I have this lubricant inside. I'll just leave it in here, or maybe I can put it outside. But this is the drape. This is fenestrated drape. Okay, these are the gloves. These are sterile gloves, so I should put them close to me. Make sure that they don't touch the 1-inch margin. This is another glove, 2 gloves here, and I'll be holding them. Okay, this is the lubricant. Here's the lubricant I'll be using. Okay, and all of them are in the sterile area. Okay, so I'll put them back here. So now what I'll do, I'll just put it back here. So I have prepared my equipment as well. Now I'll insert the catheter. Before inserting the catheter, while I'm preparing the equipment, I should open up the catheter also. So let's say I am opening up the catheter, and look here. Catheter is packed in 2 packings. One packing the first packing I'm gonna peel open. All right, take out the second packing. Okay, and I'm not putting in the sterile area, so this one is going in the garbage again. This one is going in the garbage, okay? Now, the second packing I feel open, but won't touch the catheter by hand. Instead, I would use the forceps. So I'm using the forceps here. Take out the catheter, put it in the tray. Don't touch it by hand. Okay, good. Now put this one back here in the sterile area. This one is going to garbage. Okay, this one is going to garbage. Don't lower your body, otherwise. After this, I will insert the catheter. To insert the catheter, I'll pick the gloves, sterile gloves. These are sterile gloves. Make sure that you don't touch the outside of these gloves. Just touch the inside. Your hand may touch the inside of the gloves only. So I am now putting on the gloves. So make sure that you are from outside, you are just holding it by the forceps, not touching the outside of the glove, otherwise it will become contaminated, would not be used anymore. Okay, make sure that you are not touching the inside of the gloves, outside of the gloves by hand. Make sure that your forceps also doesn't touch. Okay, so make sure that my hands are sweating. The gloves are actually stuck on my fingers. This is a very bad thing. I don't know how to get rid of this problem. I'm not making sure that I'm not touching the gloves from I have to be very careful while putting on the gloves so the outside area of the gloves is not contaminated anyways. Okay, so see that I'm making sure that the forceps is also not contaminated. Okay, see that? I have to make sure that the gloves, I'm not touching the gloves because my hand is sweating and the gloves have caught that sweat and they are not moving very easily. I don't know how to handle this problem. Stupid problem. And the forceps is also not working. Stupid. Anyways, I'll just use the other hand when I'm done with the glove. So I'll put it back here in the sterile area. Make sure 1 inch margin. Okay, I would just take it again. Hold on. I would pick this one again with this. Put my hand inside here. Okay, make sure inside here. See that? Inside here. So, okay. Now put it back here. Insert the hand, second hand in the gloves. Make sure that the outside area is not touched. Okay, again my hands are sweating. That's why the glove is not moving easily. It's holding my hand. Okay, now you can set up this one. Okay, now it's all good. I didn't touch the inside of the glove because my body had touched it. I only touched the outside of the gloves. Now what I'll do is, I've already put the glove. So I'll pick the first tray. Put it, the shiny area goes down. Okay, put it between the legs. Okay, in such a way that it's not contaminated. Then take the fenestrated drape, cover the perineal area, leaving the labia obvious or open for work. Okay. After this, I'll put the tray in between the legs. Putting the tray in between the, make sure the tray lands in the sterile area. Okay. After this, I'm holding this catheter, lubricating it. So here's my lubricant. I will hold it, open it, peel open. So let's say I peel open it and now I am putting it. So okay, so this is open now and I'm holding it from 8 centimeters in top and then lubricating it. After this, I'll just put this lubricated catheter inside here in the sterile area. This one we don't need it, so I'm going to put it outside here. Here's my container where the swab is there. I would put the cleansing solution in here. I'll put it here. Okay, this is here. I'll just put it outside in the sterile area. All right. Now what I'll do is, I have to assume that I have already put the cleansing solution in the container, and my container has now cleansing solution. While I was preparing for the swabs, wet swab, at that time I had already put the cleansing solution in there. Okay, so now what I'll do is, I'll clean the perineal area by holding, so I'm assuming that this container has the cleansing solution in it. So what I'll do is, I'll hold with my non-dominant hand, I'll hold open the labia, hold apart, and then use this catheter, okay, with one swab, clean it one side, okay, from top to bottom, through this swab. So this swab is going in the garbage. Take the second swab, clean it from the other side, top to bottom, okay. This swab is going to the garbage, and the third swab, okay, clean it from top to bottom in the center area, okay, throw it in the garbage. All right, so this one. Now put it back again here. All right, now what I'll do is, I already have the catheter. This hand is not touched the body, that one is contaminated, so I'm gonna, with this hand, I'll open it and then hold it from 8 centimeters, insert the catheter. Keep inserting it 5 to 7 centimeters until the urine comes out. When the urine starts coming out, okay, Miss Helen, the urine has to start coming out, so I'm gonna start it for 2.5 to 5 centimeter further, okay. And after this, I'll, with the non-dominant hand, I will hold here so that all the urine is collected in the tray. Once the bladder is empty, okay, once the bladder is empty, what I have to do is, I have to remove the catheter, put it back here, okay. Remove the catheter slowly and gently in one go. So remove the catheter, put it here, okay. After this, place the client, after this, I'll remove the, all the garbage or supplies which I've used already. I'll just, before that, I'll place the client in comfortable position. Bed would be down, lowered, bed rails would be high now. And after this, I would dispose of all the material. Okay, disposing off all the material in the garbage. This one is going in the garbage, this one is going in the garbage. Okay, this is also going in the garbage. Okay, this is my gloves. This is in the garbage now. Everything is in the garbage. This is sterile field. I already prepared it. This is in the garbage. I'm putting it in the garbage can here. So this one goes in the garbage. So assume that this is going in the garbage. All right. Now what I have to do is, I have to ask the client if the client is in comfortable position. Mr. Helen, are you feeling comfortable? Do you have any pain, any distension? So she said no, she is feeling okay. After this, I'll do the hand hygiene and I'll do the documentation. In documentation, I'll mention that what was the color of the urine, what amount of urine came out, what was the size of the catheter. So I use the 11 French catheter actually I was using the Foley catheter, but I would call it in and out catheter because that's what the procedure was for. So in and out catheter, I used 11 French, and the amount of urine came out to be, let's say, 500 milliliter. And the color of the urine was scanty brown, and it had the full odor. So this was the procedure. I have already documented it, and the procedure was over. Thank you very much.